subject. What is aspiration? Aspiration happens when food, liquid, or other material enters a person's airway and eventually the lungs by accident. It can happen as a person swallows or if food comes back up in the stomach. Choking is a significant concern for someone who has swallowing problems. It is the fourth leading cause of death by accidental injury. Learning about prevention can help save a life. What causes aspiration, also known as dysphagia? Aspiration can happen when food, liquid, or other material enters a person's airway and eventually the lungs by accident. Aspiration occurs secondary to swallowing dysfunction, reflex, or inability to protect the airway. Causes of dysphagia can be coughing while drinking water, difficulty feeding, and gagging during feedings.
Who is prone for aspiration? Patients who are experiencing dysphagia due to the stroke, a Parkinson's disease patient, dementia, spinal cord injury, neurological damage, elderly infants, and obesity. Preventing aspiration from occurring. So sit up straight when eating or drinking, cut up food into small portions, chew food thoroughly, avoid distractions such as talking to others and watching TV. Avoid rushing or force feeding. Diet modifications evaluated from dietitian, like mechanical soft diet, period, finely chopped, blend, thin liquids, thick liquids, mild thick liquids, and monitor for pocketing food.
Signs of aspiration: attempting to clear his or her throat, secretion from nose or watery eyes, gagging during meals, back arching during feeding, skin turning a bluish color, reddening of the face, change in breathing rate, change in lung sounds. Signs of foreign body aspiration range from coughing, wheezing, and dyspnea to hematopoiesis and choking. What to do when it occurs. If you or your child inhales a foreign object, see your healthcare provider. If an inhaled foreign object causes choking, you'll need to perform first aid and the helmet maneuver. Make sure the person is in a sitting position or standing up. If a choking person can cough forcefully, let the person keep coughing. Coughing might naturally remove the stuck object.
Negligence. As a nurse, it is important to always follow ethical principles and laws when it comes to the care of the client. Negligence is when a person fails to act carefully enough and that the person they are caring for gets hurt as a result. It is, or in nursing, negligence can be easily demonstrated if not careful. For example, failing to prevent a patient from aspirating during surgery while under anesthesia, mixing patients' trays up without double checking their diet status and causing the patient to aspirate, failing to sit the patient up in a 45-degree angle when they are eating and causing them to aspirate on their food. Nursing interventions for patients at risk for aspirating. Keep suctioning equipment at the bedside. Keep the head of the bed at Fowler's position after feeding. Allow rest before feeding times, as this may decrease the patient's difficulty with swallowing. Follow diet modifications whether the patient is put on thickened, soft, or liquid foods. Patients who are on feeding tubes should always be positioned at least 30 degrees. Request for medication formulation changes if the patient is unable to swallow foods. Monitor patients every 4 hours if they have a feeding tube. Provide oral care after feedings to prevent aspirations.
Statistics. It is estimated to cost 350 to 2,000 deaths in the United States annually. Usually male children of age less than 3 years are at high risk because of immature dentation, poor pharyngeal reflex, and a tendency to explore surroundings by mouth. Nets and seeds are commonly aspirated materials. Foreign body aspiration accounted for more than 17,000 emergency department visits and caused 220 deaths in children aged 14 years or younger. The most commonly aspirated foreign bodies in children include vegetable matter, nuts, and round foods such as hot dogs and grapes. Less common but more difficult to manage foreign bodies include beads, pins, and small plastic toys, among an infinite number of other small objects. Statistics of aspirated foreign bodies: 80 to 90% become lodged in the bronchi. In adults, bronchial foreign bodies tend to be lodged in the right main bronchus because of its lesser angle of convergence compared with the left bronchus, and because of the location of the carina left of the midline. In a child in an upright position, the right-sided airways are direct entries from the trachea. The left main bronchus is smaller than the right main bronchus and is slightly angled. In a child in a supine position, material is more likely to enter the right main bronchus. An object inhaled into the airways can cause an obstruction in the bronchi, which are the two passageways that deliver air into the lungs. Foreign bodies can also become lodged in the larynx, voice box, and the trachea wine pot.
Hospital versus Alexander. A 49-year-old woman, Wendy Alexander, was admitted to the emergency room on January 2016 because she became agitated at her group home. According to her nurse, she informed the hospital about her dietary limitations, but unfortunately was still placed on a regular diet. The nurse caught the mistake and ordered puree food, but the error was never reverted in the computer system. Unfortunately, Alexander was very medicated at night and asked for a night snack. The nurse the nurse, not being aware of the diet, mistakenly offered a sandwich. She began to choke and later that night passed away. Deputy saves a 3-year-old boy. On June 13, 2018, a mother in Oklahoma City cries for help outside her car. Her 3-year-old baby boy, Chaz, has swallowed a coin and is desperate to find help. She is seen waving people down for help when Deputy Wheeler stops to see what is going on. In the video, Wheeler is seen hitting a